So good morning, everyone, and thank you for joining us this morning. This is the COHTAC Share and Learn New School Dental Program Resources. We have a bunch of people here today to share what they've been working on as part of the School Dental Programs Work Group. So let's dive in. As always, a couple of housekeeping things at the start. So this meeting is being recorded and we always post our webinars to our YouTube channel afterward, and we send it as a follow-up to all of you who have registered. If you have questions, feel free to prop them into the chat box throughout the presentation. There's a lot happening today, and we're going to take time after each speaker to answer questions that you have. So we'll take breaks for questions, and then we'll dive into the next speakers as we go through. So go ahead and put them in the chat box as you think of them. And if you don't have questions, you can also just share other comments, resources that you have, or in other discussion. And then toward the end, we will have an evaluation poll. So we really appreciate you spending some time giving us some of your feedback. All right, so here's what we're here for today. So Paula Lee, the chair of the School Dental Programs Work Group, will kick us off to share more about the work group and the goals and objectives of the work group. And the work group has actually two subcommittees who will also be presenting. So the resources subcommittee, including Claire Blameyer, Brandy Matson, and Christy Lopez, will present what they have been working on and a bunch of new exciting tools that LHPs can adopt and use. Then we're going to turn over to the work group's data subcommittee, represented by Christy Lopez again from San Diego, who's going to be sharing some of their priorities and objectives. And then finally, we have an odds and ends portion of the agenda where members of the COHTAC team, including my colleagues Bahar Amanzadeh and Kristen Hoff, will share some topical updates and more things that are coming down the pipeline from us. And then we'll also be joined by Gary Flores from the SCOHR team and Shannon Conroy and Mariah Lady from the Office of Oral Health for some other quick updates. We'll share bios and a full list of members of the subcommittee who's been working on all this amazing stuff that you're about to see after today's webinar. So please go ahead and take a look at that later. Okay, so without further ado, I am going to stop sharing my screen and I'm going to ask Paula to kick us off.
Good morning. How is everyone? I hope everyone's doing well. My name is Paula Lee. I work at the Office of Oral Health. I'm the dental hygienist consultant here. And one of my biggest roles is to coordinate statewide school-linked and school-based programs. So I chair the School Dental Program Work Group. And I want to go over a little bit of the structure of our partnership. So the California Oral Health Partnership, it is all of you and others also that may not be on this call. Let me go ahead and minimize this real quick. Okay. So we have the California Oral Health Plan of 2018 and 2028. And then we, Dr. Jay Kumar and Rosanna Jackson, who's been here for a very long time. We also wanted to create the California Partnership for Oral Health. So it fosters dynamic individuals across California to work together through a public health approach to achieve mutual goals. And so this is the structure so that I will use a little bit of a laser. So the California Office of Oral Health is the backbone organization. Of course, we partner with our sister organization, Department of Healthcare Services, Medi-Cal Dental Services. And then we also partner with SAC State, Sacramento State University, which helps with our steering committee and our partnership. And of course, we have the amazing UCSF COHTAC that really houses the website for our resources, helps support all of our work groups. And then we have this backbone, this other blue triangle, which is the steering committee. That includes organizations across California working together. And our chairs is Dr. Paul Glassman at CNU and also Eileen Espejo of Children Now. So they help chair that. And then I will now go into our work groups and how we fit into the overall structure of all the work groups. So from our Oral Health Summit, with hopefully most of you were there, but if not, this is the structure. There are 6 main work groups. And here's our school dental program. So this is where we sit community water fluoridation, improving community oral health, policy, communication, oral health literacy, and then we have evaluation performance. And out of the summit, we noticed that we also needed a couple ad hoc work groups, which is decreasing dental related emergency room visits due to oral health non-traumatic injuries, as well as leveraging community health workers. And then we'll just keep monitoring medical and dental integration. What that looks like is fluoride varnishes in primary care and just how we work together. So here are our school dental program work group members, where they come from. So of course, it's all the LOHBs. And then we have CDA, we have a couple of programs from CDE, we have also some CDPH branches, MCH, and then we have community-based organizations like LA Trust, Center for Oral Health here in Sacramento. We also have clinicians. We have school nurses, and we have RDHs, RDHAPs. And then we have also other statewide organizations like School-Based Health Alliance. And then, of course, our amazing SCOHR team, which helps us with our KOHA data reporting. So we've launched last year, and we met with a brainstorming mural where we all kind of discuss what are our priorities, what are our expectations. And our overarching purpose is advancing, of course, the Moving California Forward work plan of 2022-2027. And our purpose is to reduce tooth decay among school-aged children through school-linked school-based dental programs. And then one of the things we discussed, to keep it simple, because it's a 2-year action plan that we're looking at. It started in 2023, but it includes 2024 and 2025. And that's to really prioritize preschool, transitional kindergarten through 3rd grade. And I'll get into more of that, what that structure looks like in a little bit. But our goals is to support the outcome of 50% reduction in oral health disparities among school-aged children. Some of that, one of the things that we could do that is looking at focusing on schools that have at least 50% free students that qualify for free and reduced meal plan. And then if you folks have gotten the January Oral Health Bites newsletter, it was emailed on January 9th. That really talks about data quests and how you could identify. I know a lot of you already have identified your schools. For those of you who are still looking to identify schools that are eligible by looking at the 50% free reduced meal plan, you can see that through Data Quest, which is a part of CEE's data website, and that is in our January newsletter. And then we also want to share best practices, tools, and resources to help implement statewide activities in school dental programs. So we have our COHTAC website, and we want to make sure we curate and have the most up-to-date, useful resources for implementation. And then also we want to implement KOHA, as that is the law. And we also want to measure performance. And we do meet a 3rd Monday of every month from typically, unless it's a holiday, for an hour starting at 10:30 a.m. And to help us reach these goals, we've decided to have a resource subcommittee and the data subcommittee, which you'll hear from later on today. So here's a bit of our structure. This is how we we call it a resource matrix, and this is the simplified version of the resources matrix. And so we look at the on top, we have the different grades: pre-K, kinder, 2nd grade, and 3rd grade. So oral health education is embedded throughout all the grades. And then also a referral management system to refer kids who have urgent dental needs, as well as really creating, establishing a dental home for those children who don't have dental homes. And then when we focus on pre-K, we're looking at a toothbrushing program. We have Toothbrush in a Box that our office has created. That's on it's on the COHTAC website. And then KOHA screening, which is a law, but it also is a best practice. To early screening and intervention is the best practices in not only oral health, but many other diseases as well. But if we look at priority schools, we're looking at 4,635 priority schools. And then as we move to 2nd and 3rd grade, we're going to screen 2nd and 3rd graders, and we're screening for multiple purposes. One of them is for sealants. Sealants, Dr. Lynn Walton Haynes and I always discuss, like, what are 2 evidence-based oral disease prevention. Community water fluoridation and sealant programs in schools are the two evidence-based approaches for prevention of oral diseases. So a shout out to the community water fluoridation work group. So if you want to join that, Dr. Pollack is involved with that. So shout out to that work group. But another reason for not only screening for sealants, but also for health outcomes. Our third grade SMILE survey is something that we do every 5 years, which Dr. Shannon Conroy will be discussing a little bit later. But it is looking at what we're doing here. Is that helping improve health outcomes over here? So that's another reason why we want to screen, is looking at untreated caries. So that is our structure for pre-K, TK to third grade. And then finally, just a couple of resources that I've included in the slide deck, which is, our brush in the box, our different sealant programs that are through SMILE California with a lot of good publication for your schools. And then Seal America, which is a great sealant program. And then, of course, the National Children's Dental Health Month is coming up. And in that January newsletter, there's so much resources for school-aged children. So that is it for me. And I will stop sharing and pass it on back to Aubrey.
Wonderful. Thanks, Paula. You packed a lot into those few slides. So thank you. All right, I want to open it up to any questions that you all might have for Paula, either about the school dental programs work group, the way it's structured, questions about the other work groups. Okay, I'm seeing a question in chat. So it's been clear in the work plan that TK, K, and third graders are the priority. Is the addition of second graders new?
Very good question. I'm so glad you asked me that, Jamie. I think in terms of looking at sealants and the sealant program that's recommended, when first molars come out, first molars are very interesting. I added the second grade, and I'm glad you noticed, because first molars start popping in behind those premolars, baby teeth, and so it's really super hard for young kids to have the dexterity to brush behind there. So in line with recommended sealant programs, we added in the second grades to start. You can start screening and sealants for second grade. So this structure is not the have to, but it is a guidance that we've come out in for the Office of Oral Health. So we added second grade specifically because of sealants. And Dr. Bahar Amandase did say second grade is also when vision and hearing screening happen in school. So there's just some alignment that we're doing there, adding second grade.
Great, thank you.
CDHA, Carol, you've asked CDHA. CDHA is involved. Actually, they're part of the steering committee. And I actually chair the Public Health Council with Jeanette Diaz, which is a Department of Developmental Services. So we're in line of really educating hygienists and alternative practice to have the opportunity. So we are just building that up. So CDHA is very involved. Me and the president, Kathy King.
Thanks, Paula. You will have more opportunities to ask questions later on. So as you think of them, drop them in the chat and we'll keep track of them. But thank you, Paula. And now I will pass it off to the resources subcommittee. And I think, Claire, you are the one who's going to share screen first.
Sure, yeah, I'll do a little intro then. I'll hand it over to Brandy. Then she'll hand it back to me. So hi, everyone. I'm Claire with San Mateo County and a member of this resources subcommittee, along with Brandy and Samaya from Santa Clara County and Nancy Starr and Christy from San Diego County. So huge thanks to all of them for their work on this. As the name says, the resources subcommittee convened to try to start to gather resources from all of you all to see if we could get some maybe templates together or best practices or figure out tools that we could create for all LHPs to use. And so thank you to all of you. We did a KOHA survey in the summer, I think, and a lot of you responded and sent us a bunch of your resources. And we looked at those and we really thank you for that, especially LA County and Orange County for your specific tools. We iterated a bit on those and we're going to share those later. But what we decided, so Paula showed you that nice matrix. There's a lot of different components of school dental programs, but when we got our heads together, we were like, well, for us, what's highest importance and urgency? And it was KOHA. And based on the webinar and registration questions and answers, all of you mentioned KOHA as the top priority the most too, so we're aligned there. And then we were like, well, what could we start to create? So with looking at all the resources and the handbooks that were out there, we thought it might be helpful if we could create like some sort of like starter manual for KOHA that LOHPs could use. It would integrate a lot of the existing information from COHTAC and SCOHR and handbooks you've created, but kind of get everything in one place, but not dictate that it has to be that way. It's just like an editable manual. Really, could we create something like that? It could have appendices with editable tools. So we jumped in and started to create that. And thanks to all of you again for sharing your resources. And that's what we're going to walk through today. We designed it to be for school staff in particular. So that audience, we know with KOHA, there's a lot of different groups that could use awareness raising, but we thought high urgency was like the school staff, nurses and office staff who actually have to do a lot of the work. What can we get them? So it's geared towards them, but it's also geared towards LHPs. You have to look through it first. We have like notes in red for you to customize it. There's places where you have to add your information. So it goes to LHPs first, and then you can customize it for your staff and get it out if you want. It's also totally optional. You don't have to use it. You probably, if you have your own things, great. If you can delete, edit, it's totally editable. You can add in your visuals if you want. So just that caveat. But so what we'll do is Brandy formatted it in this really nice way. She's going to kind of walk through how to work with the formatting in Word. Then she'll throw it back to me and I'll go through the main components of it. I'll share my screen. Then I'll kick it off to Christy, and Christy is going to walk through one specific data tool that we created because in the survey, most people were entering data into SCOHR using that quick data input form or the data input form. So we made an Excel tool, thanks to LA and their tool, which we really liked and iterated a little bit on. So thanks again. So she's gonna walk through that. Then if we have some time, I'll throw up some other like workflows that we created for KOHA, and we'll have time for Q&A. So I know it's very KOHA heavy because that's what we prioritize first. We also know there's other components. So we have started to look at oral health education curricula and gathered some of the curricula that you all have created. I think we got about 4 LOHP's curricula and then some of the things that COHTAC has shared. So we have that in a folder and that's sort of our next project, but this has been what we've been working on to date. So with that, I'll pass it off to Brandy.
Okay, thanks, Claire. Really appreciate that. So as Claire said, this is just an overview really quick. I just have a few minutes and I just want to share my screen. And disclaimer is that I am not a Word super user. But we did try to develop a nice template for you. And this is kind of, going through it so you can see kind of what it looks like. Has a table of contents. It has no appendices, but we do have a few pages in the front of the manual that are really important. We want you to read the letter, understand what this is about, how to use the template. This is just basic Word 101. I want to reiterate though that, Word can be scary. It doesn't have to be. So there are several YouTube videos. You literally can just plug in the question and it should pop out a video that shows you exactly what you need to do. But we just wanted something to be easy. So on this page right here, I just wanted you to see that there's a mini style guide. So it's already been pre-programmed with the font, styles up here in the styles pane. Can you see my arrows up here? Spacing, navigation. And this is what we came up with for the beginning. You can change this to a whole different font. You can change the sizes. It's all up to you. And I also tell people, hey, when all else fails, just cut and paste. So if you're not sure exactly what to do, cut what you need, put it in the way you want it, paste it where you want it, and that should work. It's usually best, on the desktop version. I think we found out through our team that when we did it in the cloud, that sometimes the viewing pane could be a little bit different through SharePoint. But I wanted to let you guys see kind of what this looks like. Here's some icons you can use. Some people find them useful. They're in Microsoft Word already. You just have to find them. And then, like I said, here are the headers, subheaders, body, and table of contents. We chose the Century Gothic for this one, but you guys might want to change to something else. really quick, I just want to show you that the 3 most common tabs that you'll use, okay, up here are Home, References, and View. So these are the 3, and I'll make sure that you have a note inside the manual to tell you all about this. But what I want people to realize is that this navigation pane is really ideal. And people that are used to ADA documents, they use this automatically. So they can scroll, they can touch something. Say I want to go to this in the table of contents. It goes right to that page. And so this navigation pane is great. You can also see it by page view. So just so you know that the navigation pane is great. And the way you get there is View and click that little button that says navigation pane. If you don't want it, take it off. If you decide you want to change a page the way it looks, you can put grid lines to see if it's all looking good, if it's outside the grid. But over here in the references page, you can add things to your navigation pane. So it's pretty simple. You just go add the text and you decide what level you want to give it. But these are pretty easy to utilize. If you choose to use a table of contents, you can decide to customize that. We will have one available that'll auto-populate, but I just wanted you to see the flow. If you want to change the style of I think you guys have probably seen Word and used it, but there are probably lots of different levels of users. So if you really want to use the style pane, you just go to the home page and say, I want to change that to something. Well, maybe I want to take it and I change it to the body. Well, there's the body. If I want to make it a header, that's what I do. And these are all populated for your use. And then there's references in the back, just so you see the manual. Here's some key context for you. We've kind of put a lot into it, and Claire's going to go into more detail about that. If you have any questions, please feel free to reach out to COHTAC, our partners. And like I said, when all else fails, reach out to one of us and we'll try to guide you through. If you guys have any questions, please feel free to ask.
Awesome. Thank you, Brandy. That's perfect. I'll share my screen now and we'll walk through the main components of the manual. Okay, so this is a front page. You can put in your LHP info. So everything in red is for you to add. So you can't like download it and send this out right away. There's a lot of things that you can add. This is our note to explain why we did this, and here's a template guide that Brandy just showed. Then we thought, so this is going to go out to school staff. Ideally, we thought maybe a first contact page for them at the top, so they can have our LOHP contact information, scores, even COHTACs, and some links would be helpful. So that's up front. Then we have the table of contents, and so then we go into the body. So this is a lot, and we know it's a long manual. What we wanted to do was put all information that we could get and leave it up to you to edit out what you don't want, what you don't use, what doesn't apply. So it's not like this needs to be the length if you use this manual for yours, but we just wanted to have everything that we've learned from nurses or from our experience up there. So there's an overview section where we kind of hit on the big things about COHA, the problem, the requirements, what it is, what grade levels and what schools, and then kind of the roles of different players, their role, parents' roles, our roles, dental providers' roles. Then we have a funding section, which may be too much information, but this started coming up more. So we decided to throw in a funding source section. Then we go to our next part, which is COHA implementation. Here we go into a little bit more details about like the steps of COHA. We put them into steps just to make it easier to follow. So we got to have the step-by-step guide of the main things that everybody sort of needs to do with COHA, which is you got to get the forms out first. So we have a whole section about the new forms, why they were updated, how they're different from the old forms, the links to them, screenshots, a little blurb about them. And then if they have on-site screenings, there's a blurb about the screening results letter form that will go out, and it's also included in the appendix if you want to use that in English and Spanish. Then we have a reminder step. You got to send out reminders to the kids that didn't return the forms. Here's some sample template reminder letters in English and Spanish. And then there's a data piece, right? So this is introducing schools to the fact that they have a role to play in continually collecting and tracking the COHA data from the forms. They have to do something with the forms and it has to go into a database. So we just kind of intro that here. We'll go into more detail in the next section. Then we did want to call out the follow-up piece of COHA, even though we're all still kind of learning what this means for us. So we just put in this section there, the kids with urgent dental care needs. We do want to do some follow-up. It depends on your county, like how you're doing it. We're all different. So we threw in some starter language and screenshots. You can use it or not if it's not how you do it. But this part just kind of goes through that part of the form. And then you can add in, we put in red here, if you have a dental referral management system, go ahead and put in your own processes and information for that. Then a lot of counties sometimes have a high percentage of waived forms. So we thought it might be important to have another step about possible waiver form follow-up you could do to try to prevent having high percentages of waivers. So we go through that. So that's kind of a step-by-step section. And then we get into this big chunk of the SCORE reporting. This is a long section, and it's because we put in every possible way to enter data into SCORE in this section. I'm hoping that you would then pick out what you do and delete the rest. So it's long, but that's because there's a lot of ways to enter data into SCORE. But we start with like some links to the official SCORE user manual. So that's for people to use, and there's info on COHTAC already about SCORE, so we wanted to put those in there. And then we kind of have our info about how to become a user with screenshots, and then what to do if people forget the password. That came up a lot in our experience. And then here's a long section about all the different ways to enter data in SCORE. So we go through different levels, aggregate or individual. For aggregate, there's 2 ways to enter data. You can use the quick data input form or the bulk upload. Because our survey said that most of us use this SCORE data input form, we did develop some more specific tools. This one originated from LA County, and then the next one was from Orange County. So thanks again. And Christy's going to go through this worksheet in more detail next. So here's a little blurb about them. We intro them and link them. They're up on COHTAC already. Then we go through the steps of how to enter it into SCORE with some screenshots. And then here's the bulk upload section. So if you only do bulk upload, you can delete the part above, depending on what your county does. Here we did the basic overview of what to do. We don't have as many tools for this because it's a little more complicated. We can do a deeper dive in our resources subcommittee with those LOHPs that use this if you want to try to figure out how to do the bulk upload more easily, but we don't have like additional tools other than what the guidance is in SCORE. And then there's individual level. Not a lot of us use that, if any, but we threw that in there as well. And then we added a section about running reports in SCORE. You may or may not want this. If you, I know a lot of us at the LHP level kind of take on this responsibility of helping get a data report together and analyze some data and share it. But we did want school staff to know that per the legislation, there is a requirement to send a data report to the County Office of Education of some kind. So we showed them where they can get the raw data in SCORE, and then suggested some ways to like some key data to hit on if you're going to analyze it and share it, which is this part. Like these are numbers and percentages that partners would probably want to know from your data. And then this section is tips and promising practices for implementing KOHA specifically for school staff. We know there's a lot that we could use on the LOHP end for us, but this is for them, like how to get forms returned and how to track data. And this came from what we'd heard from nurses or what you had told us. And we have, so there's just examples. You can add in yours too. And then this urgent dental need follow-up section, this is the part that we really kind of said, like, put in whatever tips you have. We don't really have a ton, and we're all different. We're all kind of building this out. And then there's a dental referral management system that's coming. So we just kind of said, you can put your own processes in for their tips if you have them. And then we have an FAQ section, using a lot of questions that we often get, those of us on the resources subcommittee. And we also pulled in some that we saw from your KOHA handbooks, if you created a handbook and had a Q&A section. And then we put the FAQs that COHTAC has about KOHA and SCORE, the links to those. And finally, we have the appendices. So these are also customizable templates, and they're also all referenced in the SCORE manual. This is already on COHTAC. It's a letter to the school board explaining what KOHA is. We created a KOHA sample timeline and checklist for schools with links to the resources they'll need for each of those steps embedded in it, and notes for you if you want to use that section or them. Then we have the on-site KOHA screening results letter. This is for schools that get screenings on site, and this is the basics that comes from the basic screening survey results letter. That's the wording that we used. Some of you already have this, or you have a report card or whatever, so you could take this out and put in your own, whatever you use or your screeners use, but this is the basic in English and Spanish. And then finally, then we have a reminder letter. So if you, for parents that haven't turned in the forms yet throughout the year, we kind of recommend doing at least 3 reminders. So school staff can put this in an email or peach jar. Actually, a school nurse created this originally for our county, and then we kind of fleshed it out. So this is directly from them. And then we translated it. And then we have a cool, Santa Clara County created an awesome SCORE data infographic, which is getting updated for the new form. So when we have that, we can put that in there. I know that was a ton, but we just wanted to show you the basics of this. And now I'm going to send it over to Christy and she can walk you through the COHA Data Excel worksheet.
Thank you, Claire. I'll go ahead and share my screen. All right, can everyone see that all right? Okay, great, thank you. And just want to reiterate what Claire said. Big thank you to those LOHPs that shared those data collection tools. And also thank you, Claire, for combining a lot of those really helpful features from all those different tools into one. And my mistake, I forgot to introduce myself. My name is Christy Lopez and I support evaluation for the County of San Diego Local Oral Health Program. So I'll just be demoing this COHA data entry and reporting tool. Just a really quick overview of this. There are 3 tabs in this worksheet you can see below. This first tab, the COHA data entry worksheet, this is where individual student level data would be entered. So each row would represent an individual enrolled student. And you can see I already have some sample data put in here. The second and third tabs are going to auto-populate based on what's entered into this first tab. So the second tab, the SCOHR data input form format, this shows the total numbers that would be entered into the SCOHR data input form. There's also some guidance in these last 2 columns that we added on checking data and follow-up actions. And if you scroll all the way below, you'll see also some screenshots on how to enter this data into SCOHR. The final tab, the COHA data summary, this has summary graphs and tables that are, again, based on that entered data. So going back to this first tab, the COHA data entry worksheet, there are drop-down menus for cells B through J, and also some of the cells will have prompts with additional guidance. So for example, this first one on the grade, it has there's a prompt with some guidance about TK data. The drop-downs are just for kindergarten and first year first graders. This has a drop-down for whether that student completed the COHA, if they completed the waiver and what the waiver options selected were, or if the student didn't return anything at all, whether they submitted the on-site opt-out letter for screenings, if they submitted the COHA form, what were the outcomes of that form? So did they have untreated decay, caries experience, and what the treatment urgency was? And then these last 3 shells are about the follow-up section 3. There's some great conditional formatting built into here, and also some additional auto-population. So for example, for untreated decay, if a student has untreated decay, the caries experience will also auto-populate. And if the student, you can see if there's no obvious problem found, the COHA follow-up items in section 3 will be gray. Similarly, if the child was recommended for early dental care, but if that child has urgent dental care needs, these last 3 items around the follow-up will be highlighted in yellow, so indicating that there is some important follow-up action items that should occur, such as notifying the parent, checking if they had a follow-up appointment scheduled, and whether or not they received the treatment. If the child submitted a waiver for each of those waiver options, the sections for section 2 of the COHA form and section 3 of the COHA form will be grayed out. So there wouldn't be any additional action needed. Perhaps if there were some on-site screenings, could indicate whether or not a child submitted the opt-out letter as well. And if the child did not return either of the forms, there's conditional formatting built in to highlight it in red if there's additional follow-up action needed with that child. And again, could indicate whether or not that child submitted a opt-out form if there was on-site screenings. So that's how this data entry worksheet tab works. And based on that information in the second tab, these numbers will auto-populate, and there will also be some prompts, some comments around whether the need to check for some data or to follow up on any action items. So for example, SCOHR, if you enter in data, if it doesn't meet certain criteria, like if items 2 through 9 don't equal item 1, then it'll read as an error and you have to go back and fix it. So this is a way to see for that error before you enter that data into SCOHR. So this prompt will show up here because we had 15 students entered, but the sum of these items, the number of students that had the oral health assessment, the waiver, and that didn't submit anything at all is not adding up to 15. So we would have to go back to the COHA data entry worksheet, adjust those numbers, and then this comment will disappear. There's some best practices and recommendations in this second tab. So for example, if there were 5 students presenting proof of an oral health assessment, but the sum of those treatment options, no obvious problem, early treatment recommended, and urgent care needed. If that doesn't equal to 5, that might signal to you that perhaps you're receiving forms that where the dental provider is not completing those options. So that might indicate a need for some education with the dental providers or the screener. And finally, in this last section, there's some comments for if ideally with section 3, if a child has an urgent need, the parents would be notified, there would be a follow-up appointment scheduled, and the child would receive treatment. So there are comments here to indicate if those items aren't adding up, if there is that need to notify the parent, if there is the need to check if they had that follow-up appointment, and to also check if they had that, if that child received treatment that they needed. And then finally, in this last tab, it'll auto-populate the tables and the graphs, which are show a nice summary of the data that's been entered for that school, and can be used to engage stakeholders at that school to sort of justify the need for a school-based oral health program at that school or on-site screenings, for example. And even though this this workbook is protected, and thank you, Claire, for showing me this, folks that are using this spreadsheet can highlight the cells in this worksheet, clicking this button in the upper left corner. They can copy and then paste it into a new workbook so that they're able to put those graphs and tables into a PowerPoint, for example, or into a report to share with others instead of needing to share the whole workbook. So with that, I'll turn it back over to Claire if there's anything you want to add about the worksheet, or if there's time to share any of those additional resources.
Yeah, thank you so much. That was a great walkthrough. And I see one thing that we'll add is when it's shared on COHTAC, the tabs 2 and 3 are locked. So we locked it so that people don't mess up the formulas. But there's a question about, can you kind of customize this form? And you definitely can. If you email COHTAC or one of us, we can give you the password, and then you can open up these pages and add other columns or other features if you want, and kind of play with it that way. And we can help you with that too if it's a little tricky with the formulas, but it is locked now, but you can ask us to unlock it, and we just have it up on the website so it's locked. And then yeah, I'll share the other tools just briefly, and then we can take some questions. So the Excel data worksheet helps people track in real time. Like I tell my staff or school staff to try, as the forms come in, try to fill out that Excel sheet if you're comfortable, because then you'd have less to do at the end of the year. But a lot of people are still, you know, they're not as comfortable with Excel. And so in that case, they like this form, which Orange County created, and we just added a little bit to it. It's a fillable PDF, and it's for those staff that maybe have their own way of totaling their data, and they don't want to mess with Excel, but they do want something like this where they can put in all their totals and then maybe send it to whoever is entering the data. It's color coded now. We love this feature that Orange County created. They talked to their nurses and asked them what they needed, and the nurses said something like this. So you could color code the form, show me like where I get all the data that I am supposed to be totaling from the new forms and the old forms, because we're kind of in this transition year. So all those highlights are here. It's a map. We call it a map. And then they know where to put those totals. And then this shows them where to log in. So it's kind of busy, but this is up on COHTAC too. And there is an older version that it doesn't have the color codes and the maps. And I have that, and I shared it on Slack. If you want that, I can send that to you. But this is also on the KOHA toolkit. So there's those two tools. And again, these are both for the people that don't use, these are not bulk upload tools, these are for the data input form function in SCOHR. And then finally, just kind of separate, as we were talking about all these processes, thank you so much to Christy, who has such a nice organized mind, and she gathered all these flow charts and workflows we were working on and put them in 4 PowerPoints that are also customizable and editable. These kind of go through all the processes for different groups too. It's a flow chart you can use if you want, you don't have to. It's also up on SCOHR. So can you see it? Yeah, so this shows different players and their roles in the whole KOHA form submission and data reporting process. And then this kind of talks schools through their process of getting all the forms, how they would be distributed, what the dentist would be doing, if they have on-site screenings, and then how to collect the forms, where they come from. This shows dental providers kind of what they're supposed to do, what sections they're supposed to fill out. And then this is, there's this whole, that urgent care needs section, the follow-up section 3, there's a lot to that. And it depends if you have a referral management system or care coordinators already worked out. But this is just kind of the basic if you're doing paper follow-up, what is sort of needed. So we put those together. You can also customize and edit these, change them, or you can you can take a picture of them and put them on forms or trainings that you're doing. So that's also up on COHTAC. So those are the major tools we've created so far. We have a few more that are on COHTAC's toolkit page. Maybe I'll just share that briefly if I can get it up. This is where, so if you go to our programs, school oral health programs and KOHA, this is right now where it is, but this may change. Then there's a KOHA toolkit page. And here's where you can find the fillable PDF, that color-coded map, the Excel worksheet, and then the process flowcharts are here. And then even some of the items in our appendices, like the reminder template in English and Spanish is here. And we can put some of the other appendix items in the toolkit separate links as well. So I think we'll stop there and take some questions if there's time.
I just want to give a quick shout out. San Mateo County, the San Mateo LHB just won their county stars award for diversity, equity, inclusion. Claire does not know I'm announcing this.
I know, what, Paula, come on.
I wanted to give a shout out because this diversity, equity, and inclusion award recognizes the county programs that foster and promote diversity and inclusion for employees and or populations they serve. And it's because the LHP and their collaboration with the partners in San Mateo County, they expanded KOHA in general, and especially to priority lower income schools by providing on-site screening programs. So they receive countywide recognition, and there's money attached to it, as well as they will be presenting to both their board of directors and their board of supervisors in the coming weeks. So really hats off to Claire. Before she came on a few years ago, there was very little going on, and she ramped it up quickly. So and she's been doing amazing. And now look at all the stuff that she's done. So, with our entire work group. So
all right. That's good. Thank you so much. That's really sweet. I have to say, we have very active dental providers, and it was playing this connector role. Luckily, we had a nonprofit clinic, an FKHC, and they kind of just needed someone to organize them, show them some goals, and then they ran with it. It was really fun. And same with school staff. They needed some tools like we shared now. They needed some guidance. They needed some concrete training, and then people ran with it. I was very surprised that and happy. I didn't think that there was so much room for capacity building. So it's really hats off to all of them. And that's super sweet. Oh my gosh. But now let's get to your question.
Well, just huge round of applause to all of you at the resources subcommittee for doing this amazing work. You're getting a lot of kudos in the chat, a lot of thanks, a lot of love, a lot of people saying that this is going to really help them and their schools in the, the work plan objective. So big round of applause. You're seeing some people giving the claps, so well done. There are a couple of questions in the chat that I'd like to get to, and then if folks have other questions, we have time and space to answer them, so you can raise your hands and we can call on you and we can chat about it. So the first question is, Yeah, about HIPAA and FERPA. So can the schools share the students' information from the COA? Someone says, our schools are concerned about HIPAA and or FERPA. Paula, maybe you can take the first stab at this one, and then if others have input, you can.
Okay, repeat the question. Sorry, I was filtering another
Yeah.
question.
Can schools share the students' information from the COA?
To who though? Because it is a challenge, because once it's with public health, we know HIPAA laws. I know a little bit about FERPA, and the little bit that I know is that once what I understand is the KOHA lives in either FERPA laws or HIPAA laws, and if it goes into the CUME file, which is their student file, it's under FERPA guidance. So can someone, whoever asked the question, can they be more specific about share it with who? I'm trying to see.
Paula, if that's okay, I can add a little bit.
Yeah, please do.
While we're getting the answer. So when it comes to HIPAA as well as FERPA, you don't want to share any identifiable data, right? So, and what it means is that, for example, if you have a small kindergarten population, and when you are sharing some data, that will lead to those students being identified, of having like a high level of decay, and then that information gets shared, which will go to the health information and becomes under HIPAA. Then yes, then you have to see for what purpose. If it's the purpose of informing some public health programming, then that's okay. Even under HIPAA, you can use that, right? That's how it protects that. But then if it's under public health programming and changing and improving the program, then you can change that between your programs, right? But in bigger schools, then it's not as much of a concern, because you're giving more of like an overview of the kindergarten population. It's not as identified, quote unquote. And I imagine the same rule would apply to FERPA. I'm not as familiar with FERPA too, but that I can say for HIPAA. This helps.
Lori, did you have a follow-up question to the HIPAA FERPA?
Hi, yes, we're just trying to help our schools out and help get kiddos, follow-up care, and the schools are feeling like they can't share the COA information at all with us due to HIPAA. And so we're kind of, we can't help.
So say that again, what can't they share?
The COA.
To
Yeah.
who?
To us.
What we had that, I might jump in here. We had that
Okay.
too. So, but if you do aggregate level data, I don't, so we just do the aggregate level data, so we don't ask it to be shared. But I think in order for it to be shared, there has to be a parent consent. Like they would have to check off something that would actively say, I know there's some counties that do this. I don't know if they want to pipe in, or maybe they could just meet with you after. But I know Monterey and some other counties, because I've talked to them, have figured out their kind of like a consent process that has been vetted by their legal team, so that the parents do consent to having the information shared with the county. But there has to be that step. But for the purposes of doing the basic COA mandate and getting the data in SCOHR, if it's the school staff doing it, it doesn't need to be shared with LOHP. The way it's shared through us is through SCOHR. So then we can log in and get reports. So that shouldn't prevent the schools from doing the COA basics,
Okay, thank you.
Great, thank you all.
One
There was
thing I
another-
can add to that. Well, I see
go ahead.
Carol wants to add. Carol, go
Yeah,
ahead.
okay, a couple things. One, after I do all the dental screenings and done the COAs, I'm actually giving a list of the kids that are in need of dental care to the school nurse. And then each child that had a COA, we're making a copy to go into their CUME folder. But we have stopped giving the whole stack to the secretary, and we're giving it directly and dropping it off to the person that in each school district that does the reporting. because I was concerned about the HIPAA requirement, that stack of COAs sitting there on the secretary's desk. And so we stopped doing that. Okay.
That's very helpful. I wanted to say something along that too. I think the whole purpose of HIPAA as well as FERPA is not that you cannot work together, is what mechanisms are you going to put in place to protect those information, right? So if you put like an MOU or business agreement in place together, and in that you define some of the steps you will take, like that, like having the forms in an enclosed place, or like giving it to a certain person, and kind of defining those among yourselves. Again, HIPAA as well as FERPA they're not intended to kind of not let us work together. They're intended to protect the privacy. So as long as you define those, you'll be fine.
And there was something about, like, in terms of like follow-up and urgent referrals, part of HIPAA compliance is when we have an urgent, it's a code of ethics, it's within HIPAA, that you can give referrals for care coordination and case management and disease prevention. So that's all. A referral is part of the do no harm as a provider. So a referral to urgent care, to a dental home, it's all within HIPAA. So there shouldn't be a problem in terms of an exam is done, it's given for case management, whether it happens on an LHP level or if it happens on a school level, it's case management, right? It's care coordination, it's all fine. So Jamie, with your hands up?
Yeah, just the state COA form, the new one, it doesn't have anything MOU wise, like written into it, asking for the shared information. We developed our own form just recently that we're launching that has that written in. But like, if we're using that COA form and there is an urgency, can we take that information as an LOHP in public health and then connect that child to a dental home? Or do we need to have more permission than what's on that COA form? I think that's the question that everyone's a little confused about.
Yeah, care coordination for linking a student with urgent care needs, whether it's in the LHPs or within the school, is fine. It is within HIPAA. It's getting that kid out of pain and getting them connected to a provider. It's a referral process. So yes, that's fine.
Okay, thank you.
Thank you all for the robust discussion. I think it's super helpful to clear the air there. There was another question, I think you answered this maybe, Claire, but is there a way to link or add a column that will show if the program will be billing for preventative dental services or sealants? So it sounds like, yes, there is a way to customize the templates that you've created to include something like this. Is that right?
It could be. It depends on like how you need to use that tool and how school staff. So that sounds almost like, I don't know if that's more for your LHP tracking. The tool we created is specifically just to do the basic COA stuff, get the 20 data pieces from the forms into SCOHR. It's just that link. So if it's gonna, if school staff don't need to see that, I didn't quite hear what it would be, then maybe you'd want a different form. But you can customize it. So yeah. And then I see some questions about, wouldn't it be cool if like people's student information systems could have the COA data in it? That's in the tips and promising practices section of our manual too. We kind of highlight if they can customize databases, student information systems to include all the 20 or 21 data pieces SCOHR requires, then that would make it easier for them to, they wouldn't need to use the Excel doc. They could just run their own report through their own information system and then put it right into SCOHR. But I know Santa Clara County's gone a little closer to some of those discussions, but thanks for those comments. I see those in the chat.
Hey, Paula, can I just jump in with another quick thing about the previous question about HIPAA? I just wanted to find the actual source, so I just put it in the chat. But this is a link to the HHS site about HIPAA that clarifies the rules, and it's very clear if you read that you don't need specific permission to share information for the purposes of health care, including referrals for treatment. So that all found allowable in communication without specific consent from parents. So if someone wants to be able to, is a little sure, can I really do this? And you want to be able to source, to be able to cite some source, this is the source you can cite.
Awesome. Thank you, Paul.
Great, Paul. Thanks.
All right, we might have time for one more question. If there's anything that comes to the top of your mind, I know that was a lot that was presented, so you might need time to digest. Again, we'll have this recorded so you can go back and look through it and watch them walk you through those tools. They are online on the COHTAC website now, so you can download them and play around with them, scroll through them, take a look. But does anything else come to the top of your mind that you might want to address now? Okay. Great. Well, thank you to the resources subcommittee again. Much love and bravos to you. Now I'm going to pass it off to the data subcommittee. So Christy, can you tell us more about what your data subcommittee is all about and what your priorities are?
Well, thanks, Aubrey. So in the data subcommittee for the school dental programs work group, we can discuss data that's needed or collected for school dental programs, the kindergarten oral health assessment data, operationalizing metrics, and any other data topics related to schools and oral health. It's a pretty new subcommittee. We've had just 2 meetings so far. And most recently, we started discussing how to measure reductions in oral health disparities, and that discussion will continue on to our next meeting. Some other topics that members were interested in discussing included measures for sealants and using data from the follow-up section on the new KOHA form. So if anyone is interested in joining those discussions about oral health data, metrics, challenges, or best practices with data collection, please reach out and I'll put my contact information in the chat and can get you involved in help, like what dates and times are best work for you for the next data subcommittee meeting.
Great. Thank you, Christy. Does anyone have questions about the data subcommittee? Okay. Great. Well, we will continue on then. And I'm going to go ahead and share my screen. So we're moving into the odds and ends updates portion of today's presentation. Okay. Here we go. Okay, so we're going to start with some COHTAC updates. So we're going to talk mostly about 2 big buckets of items. The first is ways to further support LOHPs in your school dental programs. And then I have a bunch of other updates that we're just going to run through to share with you all what we've been working on and what's coming down the pipeline. So I am going to pass it off to my colleague Bahar Amanzadeh to tell you more about the work that she's been doing.
Thank you so much, Aubrey, and hello, everyone. It's an honor to be here and sharing some information about where we are and just being part of this amazing collaborative sharing circle. So as many of you have seen that, we have the School Link Dental Program Manual on the COHTAC website. If you haven't seen it, please go ahead and kind of take a look today. Here on the right, you see a screenshot of how it looks like. It has 5 buckets, and the step 1 is preparation, 2, program setup and logistics, 3, implementing the program. Step 4 is around care coordination and referral management, and step 5 on program evaluation and quality improvement. And as you click on each step, you will see that there are a lot of resources kind of hidden there and a lot of examples from LOHPs and other school link dental programs. So again, if you haven't, please go ahead and take a look. This is intended to be used as a resource. So it's not intended to be learned in one sitting. There's a lot of information there. So whenever you're at a kind of juncture that you need to go back and kind of like, go to a think tank, then look at this and see what information is there for you to follow or to use as an example. And I wanted to also thank all of you. We held 4 focus groups to get LOHP's feedbacks on the manual and also learn about their challenges in general about school oral health programs. We had, again, 4 focus groups, 19 LOHPs participated. Amazing. Thank you again. The feedback that was provided was used both as far as like how we want to edit the manual moving forward. Right now we are working on a PDF version of it that it's going to be approved by Office of Oral Health, so we can share with you. And also another other areas that we learned about challenges, including like the difficulty of finding providers in the area, or difficulties of partnering with the schools and all of that. We're kind of working on how we can address some of these or bring some solutions to that. Another idea that came out of it is the idea of a learning collaborative that is focused on school dental programs. And so we are calling that school open hours. And I'm going to share a little more about that. And next slide, please, Aubrey. Thank you so much. So I hope the title of School Open Hours is catchy enough to get your attention. But what it is that it's really a group interactive learning workshops focusing on creating school oral health programs or troubleshooting if you are already doing them. And we are gonna create 4 to 5 groups. And the reason for that, the why of it, right? Before we go into logistics, the why of it is that, again, like what we are seeing today, like LOHPs are the ones that actually know what it takes to do this work at the community level. And we can bring the facilitation and bring the team and some expertise, but at the same time, we want you to have that space to share and learn from each other. And all LOHPs are going to be invited to join. And how it's going to happen is that we have grouped LOHPs based on their similar challenges, geography, and size, and also with some mixing so that we can create and facilitate some cross-learning. So I went through this process of like moving things around based on all of these and sprinkling around. And the meetings are going to be once a month for 1 to 1.5 hours across 3 to 4 months. We're going to start with 2 cohorts in the next few months, hopefully sometime in April at the latest. And then we're going to have, again, kind of after the first cohort starts and we learn from it and we kind of take our work to the next level, then we're going to start the second cohort as well. More information around that will be shared with project directors to kind of get your availability and how excited you are to be part of that. Hopefully a lot of you would be excited, and we can create that platform to talk more and kind of problem solve with each other. And with that, I think I'm ready for the next slide, which I think this is my last slide. Yes, thank you so much. And I will give it back to Aubrey and Kristen.
I'm gonna go ahead, and if it's okay, should we answer the question in the chat, or should we save that to the end, Aubrey? Okay. All right, so I am here today representing the work that Katie Conklin has done. Katie is part of COHTAC and has been working along with the school work group and with COHTAC on a bunch of things, but today we wanted to share the progress and the upcoming things that we have for the KOHA website. So you guys saw the great KOHA manual that come out of the school resources work group, and we are looking to help make the COHTAC resources a little bit more user-friendly, just like they did in that manual. So we are in the process of sort of refreshing the COHA webpage on COHTAC to make it much simpler, easier to follow, and have like simpler entry points. All the resources are still going to be there, but we're hoping to make it easier to follow, especially for all the new people who are joining. And so we're in the process of setting up. This is kind of a mock-up of what it looks like. And you'll be able to access that COHA manual that Claire went through on there as well. So just to note that this is coming, we'll be sharing the website with everybody when it's live. Yeah. All right. And then the other thing Katie wanted to share is that we've updated the RBA website page on the COHTAC website. You can just a reminder to go check it out. We've made some easier to follow sort of infographics, understanding what are the steps. You can also sign up for the next RBA Learning Collaborative. We have a new set of those starting this spring. So if you have not yet participated in one, it's a great opportunity to get some more hands-on help with your RBA page. And kind of in the bottom of this, the bottom left of the website, you can see the testimonials of some of the LOHPs who have already participated. It might get you excited to join. So just some heads up, go check those things out.
Thank you, Kristen. Okay, and then we also wanted to share a little bit of information that we've received from you all. So a lot of you were a part of this, but annually the art group at COHTAC puts out a technical assistance survey to gauge where you're at in your activities and what things we could do to support you. This is designed in partnership with the Office of Oral Health. This year we piloted it with a few counties to sort of just beta test and make sure it made sense. And that we're asking some of the right questions. And then we collected data between November and December of last year, 2023, so just a couple months ago. And 90% of you fully participated, which is fantastic. So we really, truly appreciate you taking the time to go through the survey and send us really rich data that we're going to be using to, like it says on the slide, really try to strategically design the kind of technical assistance that we can deliver to identify, elevate, address, amplify the common barriers and challenges that you've told us, and then just to help our team continuously improve what we do and how we support you. So to share back some of the data that we've learned, I wanted to give you a little preview of just a snapshot of some of the data that we have. So here on the screen, you can see some of your preferred formats for general technical assistance. The number one is live webinars and seminars like we're doing now. The second is small group sessions like the RBA Learning Collaboratives and the school open hours that we're launching soon. And then the third is the video or recorded webinars. And again, all of the webinars that we do, we record and we post on our YouTube channel shortly thereafter. You can find them on our website under past events. So those are always there for you to go back and rewatch. We also asked you, secondly, about the school TA and how you prefer to get TA for that. And so most of you said a learning collaborative was interesting. So that's what we're doing. We are being responsive to what you've said, and we're designing these school open hours under Bahar's leadership. A lot of you also just wrote in and said, I want both. And so we will do our best to accommodate both ways and help get the information to you and to help support you. Here's another version of the data. So we asked you which elements are included in your school dental programs and what implementation stages are you in. So this helps us understand the breadth and depth of your school programs and all the elements that are involved. So a lot of you are doing oral health education. There's a lot of expansion within KOHA and screenings with referrals. Many fewer of you are doing teledentistry or virtual dental home. Or providing treatment services or working with mobile vans. So this helps us understand. There's 60 of you, and so just trying to get a glimpse of what all is involved in your school dental programs so that we can make sure that we're addressing the most common needs, but also understanding, you know, where else we might be able to support you and help you expand some of your programs. And then I think this is the last one for the school related findings that we wanted to share, but I just wanted to point out that these are some of the top 5 school TA needs that you told us, and your top 5 COHA challenges. And as you can see from some of those percentages, a lot of you share the same challenges and needs. And so we hear you, we see you, and we're working to address all the different needs and challenges that you've shared with us. So that's a brief overview of some of the data that we have. It's very rich. And again, we just want to thank you for spending the time to submit that to us, and we'll continue to use it throughout the year. And then we'll do it again toward the end of the year, this calendar year. Okay, so then the next thing I want to share is that we have launched some new ways to collaborate and communicate with each other. So many of the LOHPs know that we launched an LOHP specific Slack workspace. So this is a place where LOHPs can join and can share with each other. You can ask questions from each other, you share resources. We've broken it down by objective and topic, so you can have specific channels to ask your questions, like about community water fluoridation, or how are people doing rethink your drink this year, whatever your questions might be. That's a really neat space for you to communicate with each other. We're also launching a COHTAC Facebook page and a COHTAC LinkedIn page to help us sort of really communicate and amplify the work that you're doing. And so part of our first jobs here is in preparation for National Children's Mental Health Month. We'll be following and liking your pages, sharing them, resharing them, trying to build up some of that social media engagement and amplification. So Gustavo, I see, is putting all the links in the chat here where you can join us and we can find you and amplify your messages too. All right, and then I just wanted to share there's a lot of things happening and coming down the pipeline. And so the first thing, just to touch on what I just talked about, if you joined us in the December Share and Learn, which was all focused about planning for National Children's Mental Health Month, we said that COHTAC would be hosting a social media toolkit on our website. We would love for you to join us to help us prioritize and co-create those messages and infographics. And we're hosting a working session next Wednesday to help us with that. I think I sent an email this morning with information, and Gustavo can also include the link to join us there. But that's the first thing that's coming up next week. And then in February, the Office of Oral Health is hosting 2 project directors meetings. The first one on the 7th is more information about COHA and best practices to maximize success. And then the one on the 14th is around care coordination and ways to use community health workers or promotoras in your work. So those are also coming up and should be really great. The agendas are packed full with really interesting and wonderful that stuff. And then the last thing that's coming is our next Share and Learn for COHTAC in March is going to be an Ask the Experts forum. And so our plan here is to invite folks from like SCOHR or from the Office of Oral Health, invite RDHAPs and RDHs who are working in the field to join us and answer questions that you submit. So it'll be, this one was a lot of information at you, and hopefully this next one will be a lot more time for open discussions and getting the questions that you have answered. And so for that one, we will be sending out some registration information very soon where you can hop on, submit your questions, and then in March, we'll be ready with all of our experts on the line to answer them. And then the last thing that I have to say, which is exciting for us, is that we are hosting 2 LOHP convenings, in-person convenings in the spring of this year. And so our plan is to host one in March in Southern California, one in May in Northern California, and the agenda will be pretty similar. There'll be one-day meetings, and we invite all LOHPs to attend one of the two meetings. And we are working on finalizing all of those details like right now and working on the agenda. And hopefully we'll be able to share more information with the project directors very soon, but we just want to let you know that this is coming, and we're excited to all get into the same room and space together later this year. Okay. So now I'm going to stop and pause and answer questions for our team. And I have not been keeping track. So Gustavo, I don't know if you wanted to hop on and answer some questions. Okay.
Yes, sorry about that, Aubrey. But yes, so we have a question from Tracy, which Kristen just put in the chat that no, the working session on Wednesday will not be recorded, but any outcomes and decisions will be reflected on that National Children Dental Health Month toolkit page. She also asked, if anybody has any ideas or recommendations to email them to our oralhealthsupport@ucsf.edu email. And then Ariel had asked about how long that meeting is going to be. That meeting is for 1 hour. It'll last for 1 hour, and we'll be working with all the anybody who registers. And then she asked, will we also be receiving hotel information, planned hotel block? Yes. So we are finalizing those details. We're going to be sending out a survey to gather information. Then once we get that, then we'll be sending out all the information for hotel booking deadlines and all of that.
Thanks. And there was a question earlier about how the school open hours overlap with the RBA Learning Collaboratives. Kristen, I'm seeing you're unmuted, so you and
Yeah, I think Bahara and I can answer that. They're separate. So the idea is that the school open hours are really going to handle that front end part about creating and setting up the programs, and the RBA Learning Collaboratives are really more on the back end working with your KOHA data. So this will be a new group of a new sort of cohort of LOHPs for you to work with. So if you've already done the RBA Learning Collaborative, that you can absolutely still do these, you should still do these school open hours. And if you start off with the school open hours and want to add in the RBA Learning Collaborative, if you haven't had a chance, absolutely do that. They're going to kind of cover the same issue, but from the two different ends. And I'll let Bahar add anything else.
Yeah, perfect. Just to add that, and also is also based, to you, if you're going through RBA Learning Collaborative right now, and you think that, actually going to both of them at the same time will benefit you, when we send that survey, let us know your time preference as far as how it's kind of interacts time-wise with the RBA Collaborative, and we will follow that.
Are there any other questions for our COHTAC team? If not, there are a few other updates that we still have to share. Okay, I'm going to go ahead in the interest of time and move forward. So there are a handful of other updates that we wanted to briefly go over. Is Gary on the line? He might have had trouble joining this morning.
Yeah, I think he had a little bit of trouble joining, so he might not be able to do it.
Okay. Paula, do you can you give us a quick update on some of the things that SCOHR is working on?
I do know one thing. The video training that's on the SCOHR website is being updated with updated information and correct information. So that's coming. They were working on it earlier this last quarter, but also finalizing it in the first couple of weeks of January. So it should be coming soon. And that's as much as I know now.
Thanks, Paula. Okay, and then some updates about the third grade SMILE survey. Is Shannon on the line?
Good morning. Good morning. Thank you, Aubrey. Thank you. It's been amazing. I'm so impressed with all the information on this call. I'm so impressed with the subcommittees. Wow, so impressive. It's my pleasure to be here today. I'm so excited about the upcoming SMILE survey. It has definitely been a year in the planning and it's taken a village. A shout out to LA. So this is done jointly with LA County. They will collect the basic screening survey information for their county, and then Office of Our Health oversees the data collection for the remainder of California. And this is so our hope is that we will conduct the survey every 5 years. So this will be the second time it's conducted. So the purpose is to get estimates for California as well as for regions for caries experience, untreated decay, sealants, and being able to look at disparities. We understand that county level data is needed. And so we are partnering with Dr. Liu at UCLA School of Dentistry to help with taking our state data and doing small area estimates to provide county level. So that is also in the pipes. So currently he is working with our previous SMILE survey data to get those methodology worked out. So we're trying to get some estimates for you this upcoming year to help with your needs assessment. So that's in the works. So the hope is that we'll do this every 5 years, the state survey, and then that will help inform the small area estimates to get county level data. And we are using this data as part of our RBA, is our population indicator. So we're tying it into our performance management system for that. So you, if you join the Learning Collaborative, you'll learn a little bit more about how we're using and tracking this data and tying it into our performance measures. So the SMILE survey, it takes a village, and I'm so thankful to our partners. Shout out to Dr. Liu. We do have our sample of schools. Again, that the state survey, it's stratified by regions, and then we stratify by free and reduced price lunch, and we take a random sample. We've done a lot. We really tried to get improve the methodology to get us enough power to look at disparities across region, and Dr. Liu has really helped us with that. So we have 180 schools that we've identified. Dr. Liu's team has created a map, a beautiful map to interact with. We're working with COHTAC to have a website so we can post that map. So we would really love to have local oral health programs engagement for helping to recruit schools this year. We appreciate your enthusiasm. So it's in the works. It'll be hopefully active in the next couple months, and we can figure out how best to engage local health programs and how best to help us recruit these schools. Because of course it's so valuable to get the participation, and we really value your guys' expertise and connections that you've already forged with these schools. So thank you so much. I appreciate your interest and your engagement. We are still trying to work out what it's going to look like. I appreciate COHTAC's help with getting that on their website and thinking through some tools to help. We are also partnering with CSUS, Sac State. They will help administering the survey for the California. So they'll hire their registered dental hygienist, do the training. Dr. Kathy Phipps is the consultant to make sure that we align efforts with LA. So it's a lot. It takes a village. We're really excited. We hope to recruit schools in the spring, so more to come. We're still ironing it out, and we really appreciate everyone's engagement and interest. So thank you so much, and more to come.
Awesome. Thank you, Shannon. And then I think we also have Mariah on the call to share more about the statewide dental referral management system.
Yeah, I'm so excited. So I just wanted to give just a quick little overview. Everything that we've worked on through 2023 has been just preparation, documentation, and getting all of our cute little ducks in a line to make sure that we can make this the best program we can make it. And so 2024 starting, we're starting the process of selecting our vendor. We're hoping to get a developed draft of the program within the next quarter or so. And then we're planning on having organized training with the LOHPs prior to the go live date. So when it goes live, hopefully that will not be the first time you're seeing it. If we can get everything according to plan, which we're very organized, so I think we will. I also included just a little couple highlights of the program features that we've requested. We had a list, it was like over 200 features long, but just some of the most exciting ones is it's going to have the ability to access and store the screening consent forms. It's going to be able to complete the screenings and generate the referrals to the local providers, and you're going to be able to designate the priority status. It's going to be able to check for errors and hard stop the form submission if the required form fields are not filled out. And you're going to be able to track the referral progress and the outcomes. So pretty exciting. I can't wait to see what the rough draft of the program's going to hold. And then I'm sure I'll have like a better update for you guys.
Great. Thank you, Mariah. I believe that was the last bit of information. Yeah, so now we're going to jump into any questions that you might have for Shannon, for Mariah, any other lingering questions that you have for today. I'm going to stop sharing so that I can see you all. Feel free to raise your hand again or unmute. Okay, while you're thinking, I'm going to go ahead and launch a little evaluation poll so you can share some of your feedback on today's session with us. I also have a link where you can share comments. Let me pop that into the chat. Are there any other questions that we can answer live here and now?
Aubrey, there was a question about how they can sign up for the school open hours. I just wanted to clarify that we will send a survey soon that kind of asks some of your preferences about which cohort you want to be part of and which days of the week work for you and things like that. And then based on that, then we will send a sign-up sheet. And thank you.
Thanks, Bahar. All right, well, I know we're at time, so I just wanted to say one more time, a huge thank you to the many, many people who put in hours of work to get those resources ready for you and to present amazing, amazing work. Just wanted to echo all the love and kudos back to you all. So thank you all for joining us today. Share your feedback with us. We love it, and I hope you guys have a great rest of your days.